We'll do them in a little bit of reverse order because of the positions. So Jurgensen's test. What's Jurgensen's test? Who said it? Thank you. Long-headed biceps test. Okay? So you got speeds, but this one's a little different. So this one's actually to pick up a biceps dislocation. So your long-headed biceps goes through the bicipital groove. And you have this ligament that runs across the groove called the transhumeral ligament. Transhumeral ligament. If that ligament's torn, the biceps tendon can jump out and bowstring out. So you're going to palpate that biceps tendon up here. And what does the biceps do? It does supination and flexion. So you're going to do supination and flexion, but you're going to actually rotate a little bit, and that's to put a little sideways tension on the bicep so it jumps out of the groove if this transhumeral ligament is a problem. So just do that motion there. And I'll do this with them a couple times, just because you can't tell the patient to flex, supinate, and externally rotate, they're going to be like, so just do this motion here, I'm going to resist you. Okay, go ahead, go. I keep an open hand. Don't grab the forearm. Keep an open hand, just resist as they come out. Good, again, okay? And you're feeling with this hand for the jump. I've only felt it one time. It's not common. If it jumps out, it's positive, surgical consult. There's nothing we have that will fix that. Truly fix it. Whether the patient wants the surgery or not, that's their call. But that's a surgical consult. Most of the time, it just hurts and it's strong, which means strong and painful means tendonitis. Okay? So that's your instance. Supination, flexion, a little bit extra rotation. Sulcus side. You can do this on the table or standing. This is just checking for instability. So you're just kind of finding the AC joint. There should be about a finger in between the humeral head and the AC joint you can pull down, and you should get an extra like half a finger when you do that. If you feel a lot of instability, that's a sign that they have a lax capsule. These next ones are capsular signs as well. The apprehension test with two parts. You're going to do the apprehension test, and then you're going to do it with relocation, also known as Job's. Okay. So Job was an early orthopedic surgeon of the shoulder, just like Hawkins and Kennedy. So they got their name on stuff. So every time we say their name, they get $1 through Zelle. Why can't we just call it the apprehension test, right? It's just dumb. All right. So what I like to do is I like to have my inside foot forward because I like to have 3 contacts, as many contacts as I can. So I'm just going to be here, and I'm just going to be like, I'm just going to bring your arm like this. Okay. Now a lot of you could be sitting there thinking, well, why is this a special test? I've already done shoulder external and internal rotation with passive range of motion. The answer is, of course. Why do we have special tests that come from physicians? They don't do all this other stuff, okay? So he's gonna stop and not let me do it. And his face is gonna be apprehension, and that's where the test name comes from, okay? But sometimes if it's not that bad of a subluxation, he'll let you do it and you'll get to end range and no pain. So then what you do is you take your inside hand here that was just kind of hanging out, and now you're gonna give the anterior shoulder, so you bring the patient out of the test position. You're going to provide the stabilization that that anterior capsule gives, and you're going to redo the test, and you should see increased, and you do. You have increased motion. He didn't have pain, but he had increased motion, so he's unstable anteriorly because I provided this support. Did you see he got like an extra 20 degrees, 10, 20 degrees? All right? The number one cause of shoulder pain in people under 35 is anterior shoulder instability. So we need to stop these door stretch things and just treat the instability with rotator cuff coordination training, which again is not 3 sets of 10, it's 3 sets of 25. And this is how, this is one of the ways you test for it. All right, so sulcus, Jurgensen's, and standing, and then get them down for apprehension plus the relocation portion of that. All right, thank you, sir.